Hello, I'm Tamas Szakmany, and I'm the Associate Editor for Social Media for Critical Care Explorations, the Society of Critical Care Medicine's open access journal. To help busy providers who have limited time, we have created critical content. In these videos, we will highlight some of the Critical Care Explorations' most recent top reads. There are several new papers published recently in Critical Care Explorations on wide-ranging topics, from pediatric and adult critical care to basic science, from quality improvement projects to randomized controlled trials, from sepsis to COVID. In the following recommendations, I will focus on some of the papers which you might find interesting. Ultrasound-guided venous cannulation for novices is an emerging skill, which can be utilized in many emergency and critical care settings. Convisar and colleagues demonstrated that using a biplane ultrasound imaging is superior to the single-plane transverse look for peripheral venous access. In the elegant crossover trial, the success rate for first cannulation almost doubled in the hands of novices who received online video training for the procedure. The pandemic has significantly changed visiting practices on the ICU, and the results of the observational study by Neville and colleagues provide some assurance that through technology enablement, process changes, and continued support from the staff on the ground, the Three Wishes program could be successfully maintained to help improving end-of-life care on the ICUs. The authors found that during the pandemic, there was an increased use of keepsakes as family presence was more curtailed. Finally, the latest paper from the SCCM-initiated virus registry looked at the use of repurposed medications in the participating hospitals during the pandemic. They found that at the beginning of the pandemic, there was no concordance between hospitals. However, as evidence of benefit for corticosteroids, antivirals, and immunomodulatory agents emerged, hospitals were clustered into groups. Interestingly, there was no outcome difference between the clusters, and the results shown that the de-adoption of certain treatments could be problematic despite good quality of evidence. Please take time to read these articles and more by visiting ccejournal.org. Also, follow us on Twitter at CritCareExplore. Stay safe, everyone.